Hi, everybody. Welcome. We're just giving it a few minutes for people to log in and getting online. So thanks, everybody, for being with us today. Great. For the HRA team, how are we doing on sign-ins? Are we ready to kick off?
Yeah, we have about 50 folks on. Can certainly give it another
Wonderful.
minute, but
Okay.
can get started.
Sounds good. Yeah, just let us know and we're ready to go. Thank you.
It looks like attendees have stabilized if we want to get started.
All right. Great. Thank you, everybody. And once again, we're so glad to have so many of our partners here with us today. If you are new to NYC Service, I'm Laura Rogan. I'm the Chief Service Officer for the City of New York. Where I'm so proud to lead our team at NYC Service and the city's efforts around service and volunteerism. So NYC Service is a division of the mayor's office, and we support individuals, nonprofits, city agencies, and the private sector with resources to come together and serve. And we do a lot of work around offering training, funding, tools, a lot of other resources to connect people to the power of service. And and truly, really bring people power into organizations as well. So kind of highlighting why we're here today, we work with you all in a lot of different ways. And we've been hearing a lot of just questions around SNAP requirements. And so today, what we wanted to do is bring everybody together around the recent policy changes that are associated with SNAP. We know that they can be difficult to understand, but also that they have real consequences for individuals, and their access to benefits and things to support themselves. So today we're going to look at the changes to the SNAP work requirements, which do include volunteering and community service. So again, in response to just questions that we've had, we really want to be here to support your engagement practices, volunteer engagement practices as they're changing, being updated with many people who are coming to you, and ensure that you have the resources that are needed to be successful. We're really proud today to partner with the experts at the Department of Social Services and HRA, and really to tailor today's briefing to volunteer engagement professionals. So thank you both, to Scott, to Sophia, and others who are here today. And we also just want to say, before we dive into anything, that today is really the beginning. We're committed to supporting volunteer engagement professionals with the information and best practices you need. We'll continue to listen to what you need, to our partners, and to work together with our agency partners to get you the information that you need. So with that, I'm going to turn over to Scott French, our very close partner who we've worked with for many years. Scott is the HRA administrator within the Department of Social Services, and is really going to give you an overview. So Scott, I will pass it over to you.
Great. Thank you so much, Laura. Good afternoon, everyone. Thank you all for joining us. And yes, we want to give you an overview of the SNAP work requirements and then really spend quite a bit of time around the volunteer options that individuals can select to do to meet these work requirements. And for that period, I'm going to bring in our Deputy Commissioner of Career Services, Safia Baptiste Taylor, who oversees all of that work and has really thought through a process through which we hopefully can continue to engage more and more organizations that are committed to volunteerism, and volunteerism in a way that can help SNAP recipients maintain their benefits, which ultimately is our goal. And the leading goal of everything we're doing is to ensure that individuals on SNAP get to remain on SNAP, as these work requirements are really meant much more to be punitive and dislocate people from their benefits. So I will give some highlights as to what is happening, how it's happening in the city, and then we will dive into the volunteer portion. So if we can go to the next slide. So many things changed in HR1 back in yes, a little, a little, not almost a year ago, and many things impacting SNAP. There are cost shifts that are being shifted to the states and ultimately the localities, which will have big budget impacts. There have been some eligibility changes that have happened around individuals who immigrant populations and those with other asylum situations that in the past have been eligible for SNAP, as well as some other pieces. But today we're going to talk about ABAWD, which is sort of middle row there. ABAWD stands for Able-Bodied Adult Without Dependents. It is a categorization of SNAP recipients that has been around for a very long time, and it's a specific sort of group of SNAP recipients who will need to keep their SNAP benefits would need to meet work requirements. In HR1, there were some very significant shifts to the definition of what an ABAWD may be, greatly expanding the population of individuals who might be impacted by this. A few of those were a change in age. The age range used to be 18 to 54. This change made it 18 to 64. It also changed what is defined as a dependent, which used to be 18 and below and is now 13 and below. And then also removed some very important exemptions for populations. So in the past, homeless individuals, veterans, individuals under the age of 24 who were in foster care at the age of 18, they were all categorically exempt from being considered an ABAWD. And the changes in HR1 have taken those categorical exemptions away. So this is a very big shift in regards to the numbers of people who may be impacted by ABAWD. And the state of New York hasn't had to implement the ABAWD work requirements for a significant period of time because we have been under waivers, which have basically granted exemptions across the whole state for individuals who were defined as ABAWDs, but we weren't implementing the work requirements. HR1 also did away with the criteria for the waivers that we have been receiving in the past. So all of that is what we're here to sort of talk to you today about in regards to what does this mean? How is it being implemented? And then how, as a city, collectively, can we support SNAP recipients? So if we can go to the next slide, please. So SNAP ABAWD work requirements, right? So there are a couple of ways for individuals to be exempt from the SNAP ABAWD work requirements. Those exemptions include they may be exempt from the general work requirements for SNAP. Often people can be exempted from the general work requirements because they are already working. And so they meet those requirements in that way. They may be taking care of someone at home who isn't a child, but someone else who has a disability or needs sort of other type of care. Additionally, they may be someone who is medically certified or physically, mentally unfit for employment. An individual who is pregnant would be exempt from SNAP ABAWD work requirements. Obviously, an individual or other member of a household with responsibility for a dependent child under 14. And in the past, living in an area where the ABAWD time limit is waived. So what are these work requirements? In general, the work requirements are an individual has to work at least 80 hours a month, or they need to participate in a work program at least 80 hours a month. That work program could be a SNAP education and training program, other federal, state, or local work programs, such as WIOA work programs that our sister agencies at SBS and DYCD run, or someone may be complying with a cash assistance work requirement under TANF that would also qualify them as complying. Or someone could do a combination of both of those things. And then the last piece, which is what we're really here to talk about, is they could participate in work experience or community service / volunteering. And when someone participates in this activity, we can actually reduce that 80 hours a month requirement by doing a calculation, which basically looks at the monthly grants an individual or a household would get, and then you divide that by the local minimum wage, which in New York City is $17 an hour. And so this is a way where, for example, on average, we could potentially reduce someone's monthly work requirements from 80 hours a month to 13 or 14 hours a month, which is a radically different proposition, right? Complying with something 13 to 14 hours a week, a month, I think is something that seems, far more doable for many people than trying to do something every single month for 80 hours a month. So this is why we think the community service volunteer aspect of this program is so incredibly important. And we've really built out a way to partner with those in the community looking to provide these opportunities, which we'll get into a little bit later. So if we can go to the next slide. Oh, and I forgot to add, if you have a question, please put it in the Q&A. Uh, all right, so how is ABAWD being implemented? So as of November 1st of 2025, New York State was required to begin assessing new SNAP applicants and households recertifying based upon the new ABAWD criteria. So since November 1st, we've been using the criteria, the expanded criteria I described on the first slide that we talked about. The implementation of ABAWD work requirement compliance, that means at what month do individuals really need to meet these work requirement hours as I outlined on the slide before, that began this month in March. So we had a waiver until the end of February. And so March 1st was the first month that someone needed to comply. So today is the end of that first month. There's additional details about ABAWD as well as links to lots of different documents and other things we have on our website. We will share this presentation afterwards so folks can use the presentation to access this and some other links that we will talk about during the presentation. So if we can go to the next slide. So what is currently happening, what has been happening since November 1st as new SNAP applicants and recertifying households enter the process. So during the application or recertification process, every member of the household needs to conduct an on-demand interview. And during that interview is when we assess individuals against the new ABAWD criteria. And more importantly, that's when we also assess if someone may meet one of the exemption criteria, because we want to exempt as many people as possible out of ABAWD so that they don't have to worry about the administrative burden connected to this. I will say, the bar for meeting an exemption is also extremely flexible. So, we are definitely trying in our interviews with folks, identify anything that might be considered a barrier to someone being able to comply with the weekly requirements, right? It's not something where we are looking for sort of a federal disability level determination. There's a variety of different things that may impact someone's ability to comply. If an individual identifies a medical or mental health barrier to complying with these requirements, if they have a clinical provider, whether that's a doctor, a nurse practitioner, a licensed social worker, a substance use counselor, or the like, we ask them to have their provider complete a medical statement form that we'll look at on the next slide and return it to HRA. They can return it to us in a variety of ways. They can upload it through our Access HRA mobile app. They can mail it to us, they can fax it to us, or anyone can drop it off at any HRA center. For individuals who don't have access to a clinical provider, we will be referring those individuals to another HRA provider through our We Care program, which currently supports cash assistance individuals who have medical or mental health barriers to employment, so that they can receive an assessment there and be determined if they are eligible for an exemption. We can go to the next slide. So this is just the form I talked about before. It's extremely simple. We just need it filled out. We are not asking for, except in the case if someone is indicating they're attending a substance use program, we are not actually asking for a diagnosis We are just asking for the provider to basically say that they believe this person has a temporary or permanent barrier to meeting the 20-hour a week, 80-hour a month requirements, and that they should be granted an exemption. People can be granted exemptions for sort of ongoing indefinitely or short term, say if someone had a broken leg or some other, injury or something that was a short term issue, they can be, granted an exemption for that period of time. So we are trying to get this form out as much as possible. We've tried to make it as simple as possible. We are also exploring other pathways in which we may be able to extend exemptions to individuals on SNAP who meet the criteria. We can go to the next slide. So what is currently happening for new SNAP applicants and recertifying households? So if someone is determined that they are an ABAWD, they will be notified by us. HRA will send a proactive notice that very specifically tells, an individual or tells a household who in that household have been identified as ABAWDs. These communications and notices are delivered in a couple of ways. Individuals can receive it in the mail. Um, Individuals who are on Access HRA can also receive e-notices that will be linked to their account so that they can find this information. So we encourage people to pay attention to your mail, but also please open an Access HRA account because that's the best way to get access to all of this information, and it is maintained there. And then for an individual who is identified as an ABAWD and are not meeting the requirements in some other way that they have already informed us of, we are providing them appointments at our HRA PACE providers, who are our career services providers who support cash assistance clients with their mandatory engagement requirements, and will now also support ABAWD individuals to explain what the program is, understand what someone is interested in doing to comply, and or if they believe the person actually should get an exemption, help them submit the exemption form. And so what we're just sort of stressing for everyone is that it's very important that individuals check their Access HRA accounts or make sure that they open their mail to not miss a notice that may indicate that they are an ABAWD. We can go to the next slide. For existing SNAP clients who were already identified as ABAWDs under the prior definition, they are going through the similar process. We started with them first because that was a group of people we knew were going to be ABAWDs, because they were ABAWDs before the expanded criteria. So they have also received these specific notices indicating they're ABAWDs, as well as connections to a PACE provider to help them connect to activities that will allow them to remain compliant with the requirements. Next slide. So what is going to happen, right? Basically starting this month. So March, by this date, individuals who are currently ABAWDs, right, are supposed to have completed the necessary hours to comply with work requirements. So that is either the 80 hours based on work or work programs, or the reduced hours if they're doing community service or volunteering. Individuals are allowed 3 months of non-compliance in a defined 36-month period before their SNAP benefits will be impacted. So if someone doesn't comply in March, their SNAP benefits are not going to be impacted right now, right? This is just the first of 3 months. The first possible month where someone may see their SNAP benefits be reduced would be June of 2026. And that would happen if someone didn't comply in the month of March, the month of April, and the month of May. So our goal is to make sure no one ever gets to 3 strikes, but we do have a little bit of time before people will see negative impacts to their SNAP benefits. Next slide. All right, so to help support these folks, and this is where I'm going to sort of turn it over, right? That's sort of the processes and the procedures that are sort of currently happening, the way in which HRA is, tracking the process, how we're communicating with SNAP recipients who do need to comply with these requirements, and all of the messaging that we're doing. But, you know, in recognition of this, and sort of as I said before, right, understanding that in SNAP we have a lot more flexibility as to what a qualifying activity might be, so that someone could comply, that really allowed more flexibility around engaging and partnering with CBOs and others around community service and volunteering. Sophia Baptiste-Taylor, our Deputy Commissioner for Career Services, sort of heard me say, what can we do? And then she came up with an approach of what we can do. So I'm going to turn this over to Sophia at this point to talk about what we have created as partnership pathways with CBOs and others wanting to provide volunteer activities for individuals.
Thanks, Scott. And super excited to hear from all of you. We have two distinct pathways that really help us filter through and make sure that clients are able to receive the support they need. And so that way it's easy for CBOs to be able to engage in a way that makes the most sense for them. The two pathways are, well, I'm going to use some of the acronyms, which is the CSP, and that's the Community Service Provider Pathway. Now, this pathway is an organization that will partner with HRA formally through our PACE providers. Under this kind of model, the organization is going to enter into a formal MOU agreement. Participants can be directly referred from our PACE providers. That's that same organization that Scott was talking about. They're contracted with us to support clients that are in receipt of cash assistance. And then those organizations who choose to be CSPs, right, that community service provider pathway, they are also through that MOU going to participate in doing attendance tracking and making sure that the client's participation is happening in real time. Now, this pathway, I would say, is going to be best suited for organizations that are interested in regularly hosting participants. It's usually really good for organizations that have ongoing need. So like, you know, every Wednesday you need somebody there to help you, or you know, every Tuesday you need somebody to help you. It's really good for organizations that have structured hours. So that's why we call it the structured community service partner pathway, because it allows for us to support the needs of the CBO, but in a very structured way where the referrals from our organization through our PACE providers will happen. And we know over X amount of time, we'll send X amount of people. The MOU agreement is really great because the CBO will tell us how many potential vacancies or slots you have available to receive ABAWD participants. And through that, we're able to schedule them out about a month in advance to make sure that they are going to meet your programmatic needs. So that's that CSP. And then the second pathway is for the self-enrolled voluntary service provider. Long names, I know. The self-enrolled voluntary service provider pathway is when an organization wants to support this initiative, but the client wants to volunteer themselves. So the participant will sign up independently. So they'll say, hey, I saw your information, or maybe you put a flyer up in your organization and said, hey, you may want to work with us. And the difference here is that there is no MOU. There's no structured MOU here, but there's also a very low burden of administrative needs from us. The structured MOU does require that like official MOU agreement with our PACE providers, and thus it, you know, in general, it works with our agency. But the self-enrolled does not have that. In this environment, the participant is able to identify and arrange those volunteer activities themselves, because we do understand that some of our clients, some of them may be working already, some of them may have other responsibilities, and we want to make it easy for them to comply. In order for us to do that, we have to have flexible opportunities for them. Again, this particular pathway does not require a formal agreement. The organization simply is just going to verify the type of activities, kind of hours that the client is doing. And that's how the client is able to prove that they've been engaged. And the participant provides that information themselves to HRA. So there's two different pathways, right? Like the CSP in partnership with the PACE provider, the client doesn't have to do their own verification because they're doing it through PACE. But when a client is going through the self-enrolled pathway with a self-enrolled provider, the client then has to verify their information and submit the documentation to HRA. So I do want to stress the differences there. Now, this option is open to any community-based organization, right? Like there doesn't have to be a size or scale for each pathway, but I do want to flag that both pathways are going to support our ABAWD clients, right? Like whatever you choose, you're still helping us. We're still getting opportunities out to clients. We really want to just be able to make it clear that these are two ways for you to engage with our population to make it easy to either receive referrals, or maybe you have people that are already working with you that have these engagement requirements and they'd like to continue. That's perfect for that self-enrolled volunteer service provider pathway, and then we'll be able to help facilitate through that. Now, in order to decide which pathway that you're going through, if you decide to work with us, we have everyone fill out a community service provider partnership form. Community-based organization partnership form. This form is going to tell me a lot about what your organization does, what types of activities, who we should contact if we have questions. It also asks if you're sure which pathway you want, and if you're not sure, we can have a quick chat to kind of talk about the benefits of each pathway that you'd like to select. Once that's finished, if you choose a structured community service pathway, we then share your information to a PACE provider to begin that MOU process. And it's actually pretty smooth. It has gone pretty smooth so far. So we're happy to hear that. But like our PACE providers really want these relationships. They want to create MOUs with you because they know where their clients can go. So we will facilitate the like matching, whether it's citywide or borough-based, or maybe you're like a zip code specific CBO. We can help you decide which PACE provider to go to, because you don't have to go to everybody if you don't need to. You can, but you don't have to. It's really up to the CBO how you would like to engage with us. And we really want to hear what you want so that way we can connect you to the right people. And then for the SCVPs, I will send you another form. And I'm going to tell you why. I know it's a lot of forms, but it's because the original form talks a lot about your organization. And there's information on that you may not necessarily want public for clients to be able to reach out to. The second form, however, is what we use to share with PACE providers, with other community-based organizations. We're going to be sharing it with clients. And that way it's information that you want publicly available about how clients can get in touch with you if they would like to self-select to work with your organization. So it's like your website. If you have a generic email address or a phone number that you have for volunteers to reach out to, it's going to be on that second form. So once we get to that space, once you fill out that form, there's nothing else to do if you're an SCVP, but just wait for people to reach out to you. If you go for the CSP, then you'll hear from the PACE provider. You may hear from some of my staff, especially if we have to get you through the MOU process. We do reach out to just verify information. And then once the MOU is signed, we add you into our system, and then you'll be ready to start receiving referrals. So I know I spoke a lot, but I do think that the two pathways, they each have their own benefits, but you can also move between pathways, because maybe you start as an SCVP and say, oh, I think we want to have more structure. We're happy to help with that. And I think open dialogue, you can reach out to me if you have any questions. It just makes it easy for us to make sure you get what you need, but also so we continue to help our clients move through this pathway. So thank you, Scott, for pinging me in on that, and happy if you have any questions.
Absolutely. And I think before we go to the questions, one other thing, because I see that there are some, one other thing I would also say around the SEVSP, that one, the self-enrolled, is I think a lot of organizations that are doing that also are doing that and sort of their approach to it is sort of doing in-reach within their organization already, right? Many of the people who have stepped forward provide a variety of benefits to individuals in their communities that they serve, and they know that those individuals are SNAP recipients, and that some of them may be ABAWDs. And so, right, there is definitely, while we also will share that information with individuals who are asking us about it, right? We do also know that there are organizations that are very much doing in-reach within their organization as well, especially if they have like case management services or other social services, to let individuals who are on SNAP, who are ABAWDs, know that like you can volunteer here, because we also think that someone is probably more likely to comply if they could do their activities with an organization that they're already connected to and that they already trust. So if you're already accessing programming at a older adult center, well, if you could also volunteer during lunch service or meal service at that center, right, that's probably something you might be willing to do, right? And so that's also one of the things we really wanted to leverage here, which is why, Sophia came up with these two pathways, because we know there's different ways in which folks may, best be engaged. So, but I think we can turn to the questions that we have. So I'm not sure. Lisbeth, are you or Steph, are you going to run through
Yep.
the questions? Okay.
Yep. So we've got a couple of questions here. So the question here is part in kind, is part in kind equal to required work, such as already meeting or surpassing minimum work time with other valid or work? And can online education also count?
Sure. So I'm not 100% I'm following, but I think this is saying, I think the question is around, can there be a combination of activities that someone does to meet the 80 hours a week, right? Some of it being work potentially, but then some of it being education, maybe training or other things, which yes, education training, though I think we need to understand what that education training is, as long as it's connected to some other type of federal, state, or local work program, which I think lots of things are, right? But I think that would be we'd have to have a specific conversation with that person to understand what the different components are to make sure that they actually meet the requirements. Was I right on that one, Sophia?
Yes, that's correct. Because it's going to vary depending on the person and what they're like going to school for.
Yeah. And so for those folks, that's why it's super important that they engage with the PACE provider that they have been connected to, because the PACE providers are going to be the experts of being able to break down the activities and making sure that the person is covered in regards to, yes, this combination of things will allow you to maintain your SNAP benefits.
So here's a question. If an organization has a long onboarding process of perhaps 4 to 6 weeks, are they still able to be a CSP?
That's a great question. And yes, but the client would not be able to count those hours during the onboarding process. So if a client decides to be a CSP and working with their PACE provider, they would have to continue going to their PACE provider as well as doing the onboarding process. And then they would be able to count once the onboarding was done. So yes, you can, but it will take time away from the client being able to engage.
A clarifying question there, Sophia. Many volunteers also need to go through training or orientation, and which typically in the service world, those hours count towards time served. Would that count?
I think it depends on what the activity is. Like we would need to hear more about what the training activity looks like, but like general onboarding wouldn't count right away. Because that's like policies, procedures. Like think of it as career exploration, right? Like if you are going through a career exploration exercise, while onboarding is doing some of the work, then maybe that would qualify. But if it's just like, like right to know training, that would not qualify, if that makes sense.
Next question. Are CSP organizations obligated to provide placements for 36 months per person for a mandatory number of service hours per month?
It depends on the MOU with the PACE provider, because we do understand that like everyone has seasons, right? So like maybe you only have a season where you need support. Maybe it's just summer or just winter, whatever. That is a conversation for the PACE providers. Typically, no, we don't necessarily require a 36 or even 12-month commitment. You would expound upon what that commitment would be in the MOU.
And then just there was also a question. Can you just explain MOU for folks? Yeah, it's okay.
It's a memorandum of understanding. It's like an official agreement between the PACE provider and the community-based organization. And what it is, it's a way for us to understand what the PACE providers expect from you, but also for you to understand what you expect from us. If you say I need 20 people every month and we give you 10, then we are not moving through our MOU properly. So it's a way to keep everybody accountable for serving people in the way that we have described that we would serve them.
Okay.
That's a great question. Sorry about that.
It's okay. Are individuals required to commit to an organization for hours, or can they move between organizations to satisfy their hours?
That's a great question. And yes, clients are able to move between organizations depending on the pathway that they choose. If a client decides to go through a PACE provider and do a structured community service outcome, then that's what their assignment will be for the duration of that assignment, right? So if it's 6 months, it's 3 months, we expect them to commit to that period. But if a client decides to do a self-enrolled pathway, they could be at a food bank for a month. They could be at a soup kitchen for another month, or at a clothing drop for the following month. And I think that flexibility is why we decided to have 2 pathways, to allow participants or clients to be able to choose if they wanted that consistent structure, or if they wanted to try new things.
How soon should an SVP site begin in-reach to enlist volunteers?
Well, it's March. So I'm sorry, Scott, should I leave that to you? I want to say it's
No,
March.
that's I think it's the moment you're approved by Safia's team. I mean, you can actually start now, because I see another question too of if you don't register with us, do volunteering hours at an organization count? And the answer is yes. We prefer that folks register with us just so that we know and that we can share that information with folks, right? Around like these are organizations in New York City who have proactively stepped forward and said, we want to provide opportunities to folks to support themselves so that they can maintain their SNAP benefits. But if you're an organization, right, that is like, oh, we haven't submitted yet, we're gonna, but like you have actual robust volunteer activities, right, that you utilize, right, you can begin in reach to folks that you know maybe need help complying, and they can start. Just got to make sure that the person fills out the form, that you sign it, and that the SNAP recipient submits it to us. So folks could start that now. I think the more information we have where we can sort of direct and identify people, right, the more we wanted to be able to provide to SNAP recipients so that they aren't sort of like aimlessly trying to figure out what to do. But
Awesome. Okay, great. If someone is volunteering with an organization that doesn't register for either pathway, will those hours be countable for an ABAWD?
yes, as long as it's a CBO, I think, right, Sophia, like when submitted, we will look, if they're not on our list, we will probably do a little due diligence just to say like, let's make sure we feel this organization aligns with other organizations and credibly would provide similar activities that we think would be covered.
Right.
Could you, so for example, would that mean it has to be a 501c3 or?
No, it doesn't.
No, yeah, go ahead.
Sorry, it doesn't have to be a 501c3. It has to be a community-based organization serving the community.
So can I ask for a point of clarification? What could that be, like a mutual aid group or like a house of worship? Okay.
Yes. Yes, it can.
Yep.
Great.
Great question. Yeah, it can.
Yeah. And
We
we're
get a lot of
defining it.
differentiating.
Yeah.
That's
Yeah.
like,
Yeah.
We're trying to define it as broadly as we can, but we do need it to stay within some, right, relative
Yep,
parameters
that makes
of
sense.
yeah.
Okay. Just a follow-up question on that too. For does volunteering related to like advocacy efforts or like political candidates? No, that's a no.
I would,
Okay.
I would say no. It
Okay.
is, I think, volunteering that supports the community-based activities of that organization that are serving the community in which they operate
Okay.
is qualifying activities. Yeah, I think,
Excellent.
yeah. The other stuff would run, I think, yeah,
Nope, we're
yeah,
aligned.
yeah, yeah.
Um,
We are
I
going to be probably studied very closely by, externals on what we have
yep,
allowed and that counted. Yeah.
absolutely. Yes.
Mhm.
I think so the question here from Beatrice is
Mhm.
what hours are clients allocated? I think maybe this question means where are client hours tracked?
That depends, right? Because this could be two things, I think. One is how do clients know the number of hours that they need to comply, especially if they're doing community service volunteering, right? Which, right, strongly encourage folks to engage with the PACE provider, even if they're going to do SEVP, just to get clarity around how many hours a month they should be targeting. Um, and then tracked, I think, to what Sophia said, it depends on if you're CSP, right? If a CBO does CSP, that CBO is going to track those hours and report those hours. If it is self-enrolled, the individual needs to track their hours and on a specific form and then have the CBO sign off on that form verifying the hours and then submit that to us. The client has to submit that to us.
And so just another question there, is there any real-time record that someone could view of their own hours that they've tracked? Or they just kind of have to keep track of them?
They have to keep track. I mean, I think if you're talking about someone who's doing self-enrolled, like doing this on their
Mm-hmm.
own,
Yeah.
they need to track that with the organizations that they're doing. The form itself is very simple. So like it is the type of thing where someone could just keep track of it on that form. Like it's really like the date and the number of hours. Um,
If a client did an assessment in March and the effective date for them to begin their volunteering hours is April, will that affect them for the month of March?
I th I think this is let's talk about it this way. I think when someone is either applying or recertifying, that period during which we are making a determination as to if they are eligible, they do not need to comply with ABAWD if they have been identified as an ABAWD. You only need to comply with ABAWD once you have been approved and are receiving ongoing SNAP. So, for instance, somebody who is currently on SNAP and wasn't an ABAWD under the prior definition, right? They've now come, they're recertifying, they have to recertify in April. And they call in April, they do their interview, and based on the new criteria, this person is actually going to be an ABAWD, right? They don't have to start complying until we have accepted, we have recertified their case, and then they do, and that will generate the letters and that will generate their appointment. So they don't need to really start complying until they receive those official notifications and that appointment to meet the hours in general. I think that is what the question was trying to get to.
Does SEVSP, that might be a little confused, have a workman's comp policy? And would volunteers, no, okay. Sorry, go ahead, Sophia.
No, I was saying no, because
Uh,
it's like if someone walked in off the street and wanted to volunteer with your organization, think of it that way. Like there is no, at least not from our point of view, because we don't have an agreement with the CBO. Now,
Oh.
with a structured community service provider, that is a piece of the structured MOU, right? Like they talk about workers' comp and whether it will be the CBO or whether it would be the PACE provider that covers. And that's a part of that negotiation. But for the SCVP, think of it as like someone coming in off the street to volunteer with you.
And also,
Sorry.
just say, I just see something here around exemptions for everyone. What we listed on today's slide are illustrative, not comprehensive, right? So there is, right? There's a long list of exemptions, and then there are very generalized categories of exemptions as well. So like what we listed today was simply illustrative of these are the types of things, but we explore all exemption types during the interview with individuals.
Here we have, can you clarify the reporting of hours? Does the organization report hours for each individual, or are the hours reported by the individual satisfying their own?
So depends on the pathway, right? Like if you're a CBO that does structured community service, then as a structured community service provider, you would report that timekeeping in collaboration with the PACE provider. If you're a self-enrolled voluntary service provider, then the client themselves is going to self-attest to the time. So they do their own timekeeping, but they will bring a form to whoever is like overseeing or like managing the volunteer activities to like sign off on like doing that activity. So it depends on the pathway you pick.
Steph, you're muted.
Sorry. Can organizations register for both pathways? And then once submitting a registration, what is the process afterwards? And what does notification look like?
Absolutely. I do suggest picking one first because it's a process. But when a CBO decides to be a structured community service provider, we will vet, because no matter what you do, you have to fill out the original form, right? Like that's the community-based organization provider information form. And that is how we'll decide like if you're even eligible to be a provider at all, right? Like if the activity aligns with what is acceptable, right? For clients. Pending that, like we'll review that, we'll check, we'll Google you, if you will, to kind of see a little bit more about you if there's some questions. And then we'll decide whether you're a CSP or an SEVP, SEVSP. You can tell me which one you would prefer. And if you say that you're not sure, we'll meet to kind of talk about it to find what makes the most sense. If you're a structured community service provider, we will connect you to a PACE provider or all of them, depending on what your interest is. If you'd like to serve citywide or if you'd like to be borough or zip code based, you'd let us know that. And then the MOU process happens in combination with the PACE provider. So they will help walk you through the process of finalizing the MOU. The MOU from the PACE provider will then come to the Career Services Contract Budgets and Special Projects unit. And once that happens, we will like say, yes, you know, everything's good on the MOU. We approve it. We let you know that you have been approved, and then you'll be able to start receiving referrals directly from the PACE provider. For self-enrolled, once you do the original form and say, hey, I want to be a self-enrolled service provider, I'm going to send you another form. And that second form literally takes 5 minutes. It is very short, but it's requesting the information you would like published or shared with the public, right? Like it's information like what website you want to use, what specific contact person you want. Is there a phone number you want people to call to get in touch with you? Because self-enrolled, we're going to have like a directory where clients, even our PACE providers, may share your information to people that say, I want to do this myself. I can manage my own time. I want to share it out. So once you do the self-enrolled second form, there's nothing for you to do other than reach out to your internal community or like answer the phone or check your email when people reach out and say they're interested in working with you.
Quick thing, Rima, who I see put something in about a very specific client and SSI as disability. Could you just put your contact information in the chat, and we're going to have someone reach out to you to specifically look into that case, because the person on the face of it should not have been classified as an ABAWD, though. we should check into that. So thank you.
Questions on what is there a limitation or you mentioned that anyone who completes the form will the role or the volunteer description would be reviewed. Can you share a little bit more about if there are limitations or what a really solid volunteer opportunity would look like?
It depends on the organization, right? Like the organization is going to tell me, because truthfully, I'm the one who reviews the list after you submit the form, right? So like we've had hundreds of responses, a little more than 100 that have reached out. And it really, when I have questions, is if it looks like it's replacing a job, right? Like in order to be an engagement activity, it cannot displace a role that you would have had within your organization. So signing up and saying I want somebody to do accounting would not qualify, and that would like flag for me that we should have a discussion about like what community service activities look like. Think of it as career exploration with a community face, right? So like you're gonna want people to help talk about your organization, maybe be at the front desk, maybe interface with your clients, maybe sort through donations. Those are the kind of things that qualify as a community service activity, but things like billing do not. I hope that was helpful.
Other questions for anyone on the pathway? Will folks who are considered a partner provider be informed of the total number of a client's hours to complete? And what sort of documentation are the pathway providers required to complete?
It depends on the pathway, right? Because if you're a SCVP, there is no requirement. Like you decide who you want to work with you. And for the structured community service provider pathway, that CSP pathway, that's all outlined in the MOU. So you'd say we want 100 people for January, 2 people for February, and it can spell it out like just like that. And then the timekeeping requirement, usually our PACE providers, they're pretty tech savvy. A lot of them will say, hey, we use Salesforce. Can you document the time in Salesforce? Or some use like a sheet. They'll say, hey, can you have the clients fill out this sheet and submit it back to the PACE providers weekly or monthly? Like it depends on the provider that you decide to engage with, but it's usually very simple and it's predetermined, right? Because it's already outlined in the MOU, you would know how many people that you're going to be receiving. You'd be really clear on like what the timekeeping or engagement requirements would be prior to receiving referrals.
And just seeing we're coming up on time, there are many more questions in the chat. Maybe we can do one final question. Okay, great. This is about the contact who should be listed in the form for the self-enrolled. Should it be any staff or should it be a specific contact, perhaps the person who is signing off on the volunteer hours?
I think that's up to you to decide. A lot of the CSPs that I've seen are using like the generic phone number, like to the organization, because multiple people will answer that phone. And I think just from my perspective, like people go on vacation. You want to make sure that when people reach out, that like someone can get them the information that they need so you don't miss out on a potential really great volunteer, like ABAWD volunteer. But it really just depends on you as an organization and what you'd like to have listed publicly. It can be an individual person if like that's a part of their role and responsibilities, where we always love to have direct contact. But like if you can't and you want to use the generic general phone number, that's fine. That is not the phone number to use for the original form, because like the first form is you're talking to me, right? Like I'm getting all the information. If I have a question, I may call or reach out via email. So I definitely think like a real person would be helpful there. But for the public forum for that SCV piece, it can be the generic like main line.
Okay, wonderful. So just a couple of questions or just a couple of follow-ups for our folks here. This was recorded and we'll plan to share that out. We'll also provide like a written share out of what was discussed here today. If you do have questions that were not answered, we'll also kind of pull together a way to collect those so that way we can again report back out and come up with some resources for everyone. Any final notes, comments from our team here?
Thank you all for caring and wanting to help. It's really amazing, and it really does require all of the city to come together to be able to support people so that they can keep their SNAP benefits. So we really appreciate it, and Laura, Steph, very much appreciate the partnership and bringing us together to talk about this.
And same, echoing back just all of the work you're all doing to ramp this up very quickly, for our partners, but also for all the residents across New York City that are deeply impacted by this. And just, and to our partners on the phone, as I said in the beginning, this is hopefully the first of additional conversations. Please reach out to us as we can help you, and connect you to the right places in the city, as well as just these maybe, if we're getting lots of questions, we can ramp up an info session like this too. So just keep us in the loop, however we all, collectively can be of help and support to all the great work that you're doing out in communities and directly with our residents here. So thank you, everyone.
Thank
Yeah.
you.
Thanks, everyone.